Okay, good morning. So today we will start this class. The topic of which is prevention and control of public health hazards, particularly alcohol. Okay. So you are studying in FAP, right? Family Advisory Program, right? In that, uh, what was the previous topic that was taught to you? Do you remember? Demographic. After that, was there an NCD? Yes, NCD class. So non-communicable disease. So whatever things these NCDs are, ठीक है, NCD के risk factor क्या क्या हैं? What are the risk factors of NCDs? Non-communicable disease. ठीक है, what are the non-communicable diseases? Cancer, very good. Then diabetes, obesity. ठीक है, obesity is a condition, but it can be a disease as well. I mean, it has some manifestations and can have complications. Yes. Metabolic syndrome, very good. Genetic disorders like any other non-communicable disease, please. Yes. Huh? Genetic disorders like, can give some example. Okay, so yes, genetic disorders are also sort of because they are non-communicable. Whichever is not communicable is non-communicable disease. That is fine. But what are the common non-communicable diseases? So diabetes, hypertension, any other heart disease? What are the heart diseases? Cardiovascular disease, myocardial infarction, the group of heart diseases. Any other? Cancer, you have told. Very common ones. Yes. Nutritional disorders. Okay, but what is the disorder? What is the disease? Okay, so yes, they can be non-communicable diseases, but some non-communicable diseases which have been grouped as non-communicable diseases in particular have some common risk factors. Okay, common risk factors. So they have been grouped as non-communicable diseases. Apart from these, what we had discussed now, have you heard of stroke or cerebrovascular accident? That is also a non-communicable disease, right? Have you heard of? Yes. Arthritis is also non-communicable disease. So non-communicable, anything which is not communicable is non-communicable. But there are group of diseases we usually group as chronic non-communicable diseases, where there are certain risk factors which are common to these non-communicable diseases, particularly when we study about public health. In medicine, you will go for genetic disorders, all are non-communicable, obviously, they cannot be communicated one person to another. But in public health, we focus on the more common ones, non-communicable disease and their risk factors, right? Because they have very common risk factors, very common way of progression, all of them are chronic. They can have acute manifestations, but mostly chronic. And so, that kind of diseases we group together as chronic non-communicable diseases. So, apart from this, have you heard of COPD? What is that? Yes, that is another disease which is also non-communicable disease. Have you heard of CKD? Chronic kidney disease, very good. So, chronic kidney disease is another disease. Apart from that, any other? Chronic liver disease, have you heard of? Yes, yes. So, these are the common NCDs, and many NCDs, as I told, we have risk factors, very common risk factors. Okay. Can you tell some modifiable risk factors and some non-modifiable risk factors for NCDs, non-communicable diseases? Very good. Diet. and nutrition, fine. So, that is modifiable, yes, very good, yes. And exercise and physical activity or is changeable, is modifiable, fine. Anything else that is modifiable? Lifestyle changes means? Yes, modifiable, but what are the lifestyle changes? Yes, yes. So, again tobacco, alcohol, ठीक है. Diet, physical activity, tobacco, alcohol. You told two, you told two. These are the four main common modifiable risk factors for most of the common NCDs. You think of any NCD. Hypertension, are these four common risk factors? Obesity is also a risk factor, but obesity is the result of diet and physical activity. Somewhere it is linked to that. If it is genetic obesity, yes, it can also be a risk factor, but mostly it is resulting from diet and this thing. So, obesity can be taken as one condition which is also a risk factor, but sometimes is a result of these two. So, out of these, can you think of any disease which is not related to these? Diabetes. So, mostly stroke, cardiovascular disease, tobacco, alcohol, both are involved. Okay. So, that kind of thing is there, okay, and that is why we are focusing on their risk factors also. So, what is family advisory program? You go into the families, okay, you are going into the families and dealing their health problems. They are first getting to know what are the health problems, that is the most important step. Unless and until you know what are the health problems, you cannot take out the health problems, health and other associated social, psychological or other issues which are also related to health, but mostly health problems. So, you will take out some this thing information regarding alcohol also, tobacco use also, diet, physical activity, in your subsequent field visits. Okay. You are going in monthly field visits, right. So, and that because you have adopted the family for a longer term. So, you will be uh, asking this information, then please do not talk, yes, asking this information, extracting this information, analyzing this information in your brain, and then coming out with some solutions with the help of course JRs, SRs and faculty in of your department. Okay. So, that has to be effectively delivered to the population, okay, and or the families you are going in. Okay. So, alcohol, what do you think are the problems related to alcohol? Before starting the slides or this thing, let us interact, because it is more of interaction, right. And when you go into the families, you have to deal with these things. Okay. Suppose there is a alcoholic in the family. Alcoholic means somebody who is taking alcohol, and suppose he is he or she, whoever it may be, is in the in that state, okay, mental state. He has recently drunk alcohol. How should you behave in that family? You have gone for a this thing.
First, we should not be impulsive towards him because he is also that way. So, if you suddenly say that don't do this, don't do that, then he won't listen to us. So,
Yes.
to deal with him very step by step, just
Okay. Yes. Any other thing? You have gone to the family. There are other members also, and you are, maybe you are trying to get some other information. But this person is coming and he is, trying to say something or trying to, but he is in a not in a complete normal healthy mental state because of the, his addiction and this thing. So, how will you behave and how will you, this thing. So, how will you tackle this person? What will you say to the family? That what should be done with this person, I mean what health problems this person can have in future. तो क्या बताओगे?
first try to tell the family to take him aside because अगर उनके सामने बोला तो
हाँ,
problem is.
okay.
Then we have to make the family aware about the risk factors.
About the risk factor. Okay.
And then we can make them aware that there are rehabilitation centers. So if he is a major alcoholic consumption,
Huh.
he can be treated that way.
Okay. So, what is major alcoholic syndrome, or whatever you are saying? How will you distinguish that? Is there any criteria to distinguish that this person is really affected from alcohol? What is the term used there, right? Dependence, alcohol dependence. If he is dependent on alcohol, means is addicted, means both psychologically and physically he is dependent on this thing. It could be physical dependence, it could be psychological dependence, or both, but the person's body is craving for alcohol. Okay. So, have you heard of alcohol withdrawal syndrome? Yes. So, that means if a chronic alcoholic whose body has already become dependent, so he is physically dependent on alcohol or psychological dependent, then he or she cannot uh, you know uh, withdraw from drinking for some much time. So, if you stop alcohol for some time, there will be no bodily symptoms and psychological symptoms coming up in this person, which are withdrawal symptoms, symptoms of the withdrawal. Unless and until he takes alcohol, he will have again these continue to have these syndromes for some time. So, that is another issue. Okay. So, first of all you have to define a cutoff, right. So, that kind of thing. Then what do you think is the burden in the in India of alcohol? How many people are drinking? What age usually they are drinking alcohol? Yes, anybody? College, somebody is telling college. Yes, all age. Okay, all ages. Yes, all ages are drinking, but what is the common age? More affected age? 22. Very good. So, it is a more of younger age, we will come to that. Okay. So, those ages, okay. And then once you assess that this person is so step by step there are certain things, right. One of them is that you have to know that this person is having alcohol. Okay. So, rather than asking that person, you can ask some other person in the family, a family member, who can know that yes, this person has taken alcohol, because there are other drugs also under which this person can have influence of, right, like cannabis or other tobacco, other products. So, first you have to know that this person has taken alcohol. Okay. So, for that you have to ask, you have to find out that yes, this person has taken alcohol. Now, is the alcohol is this person dependent on alcohol, or it is he is infrequent taker of alcohol, okay, user of alcohol. So, how will you determine how much alcohol this person has taken and whether he is dependent on alcohol or not? Okay. Is there any way to find out? For that you have to know what are the types of alcohol, what are their concentrations. If you do not know, then you cannot assess, right. So, how will you know? Any idea? This is a public health problem, it is a big public health problem, alcohol use disorders. So, you should know, you have to know this. तो कैसे पूछोगे? What are the things that are important in eliciting information about alcohol?
Depending on the state, like how much conscious he is at that moment, you can determine whether he is taking high amount of alcohol.
Fine, that you can see and find out, that anybody can see and find out, his family members, his neighbors, they can also find out that. But as a medical student, what extra information you will need to say that yeah, that is liver enzymes are there, which some liver enzymes they are specific to alcohol related this thing. So, they will increase. Okay. So, that is a separate issue and that will come down the lane. I mean initially you have to first find out has this person, some people are all persons who are taking alcohol dependent on alcohol? No. So, first step is that. So, how do you find out? Asking family about what? Yes, very good. Regularly and how much means frequency and amount, two things. Okay. So, and third is type of alcohol. Why? Concentration are different. Okay. So, frequency, first is frequency. So, you will ask, how frequently, whatever is the name of the family member, he or she drinks. Okay. So, they will say some frequency. Frequency कैसे होगा फिर? फ्रीक्वेंसी में कैसे आएगा फिर? हफ्ते में कितनी बार? वेरी गुड. या दिन में कितनी बार? ठीक है. या वो पूछना पड़ेगा कि डज दिस पर्सन ड्रिंक डेली? यस, ओके. और 2 or 3 times a week, or weekly once, or infrequently, monthly once or twice, socially, or infrequently. Some people drink socially. So, that these things you have to know. Otherwise, you will brand everybody as alcoholic and start some medication counseling for that person who is a normal healthy person, but sometimes he takes alcohol in social gatherings. So, that is not alcohol dependent person. Okay. He does not have to be sent to the rehabilitation center. ठीक है. सो ये चीज़ें नहीं पता होगी तो गलत तरीके से उसको हम डील करेंगे फैमिली में. ठीक है. सो दैट वी डोंट वांट. ठीक है. सो फर्स्ट ऑफ ऑल फ्रीक्वेंसी वी विल आस्क व्हाट इज द फ्रीक्वेंसी ऑफ अल्कोहल. सो वीकली ऐसे क्वेश्चनर्स भी हैं. देयर आर सम टूल्स फॉर अल्कोहल स्क्रीनिंग लाइक ऑडिट टूल, AUDIT. वन टूल इज देयर फॉर विच यू कैन स्क्रीन. ठीक है. देयर आर अदर स्क्रीनिंग टूल्स एज वेल, बट usually in undergraduate when we go in the field, we usually don't use those screeners, but we can use if we want to find out more about this thing. They are structured questionnaires globally used. Okay. So, that is there. Then ये हो गया. ठीक है. If that person is drinking socially once in a fortnight or once in a this thing with friends or whatever, this thing, so that is a issue. Then whether that is an issue, how much that is an issue. ठीक है. Then if he is taking weekly once or something like that, ठीक है, and then he is taking daily, and daily how much, then comes how much. ठीक है. So, what is the safe limit for alcohol per day? Is there any guideline on that? So, again you have to know this. ठीक है. So, daily अगर वो ले रहे हैं तो कितना ले रहे हैं? ठीक है. और क्या ले रहे हैं? ठीक है. सो समबडी इज टेकिंग डेली. सो डेली मीन्स देयर इज अ प्रॉब्लम, आई मीन सम प्रॉब्लम इज देयर, बट डेली ऑल्सो हाउ मेनी, how do they say? I mean you have to know how do they say in the community also. It's not that if you say 200 ml लेते हैं क्या, है ना, 300 ml है क्या है, ऐसा नहीं पूछ सकते आप. You have to know कि how much they take and those measures just to understand and find out the things. ठीक है. तो how much is the how do they say in the community of people generally take. ठीक है. So, some tell that one full bottle, quarter, some things like that. ठीक है. Quarter means 250 ml. ठीक है. Less than that pack. ठीक है. 60 ml large pack, small pack 30 ml like that they tell. If you don't know this, you cannot assess the quantity. ठीक है. So, they will tell like that. 2 large pack, 2 large pack लेते हैं एक दिन में, ऐसा कुछ बोलेंगे. तो you have to understand that is 60 plus 60 120 ml per day. ठीक है. So, that you have assessed now. You have assessed the frequency. Okay, this person takes daily. This person is telling 3 large packs in a day, 180 ml per day, which is above the safer limit. ठीक है. So, in most guidelines, and then he is saying that what type of alcohol. So, large pack means what, if it is spirit, I mean the whiskey and the rum, all those things, then it will go to around 37 to 43%. ठीक है. So, volume by volume. So, that is the weight this thing. So, how much concentration is there. ठीक है. Then below that 18% wine. ठीक है. Most of the wines are in that this thing zone. ठीक है. Whiskey, rum, vodka, all those things they come in the higher zone, 37 to 43%. Then I told wine, and then beer it has 5 to 18%, 5 to 8%, and the other local alcohol is also available, which are mostly spirits. So, it can vary, but sometimes because it is locally manufactured, it is not within the range of 37 to 43, but may come down to 33 or 30, 27 also sometimes. So, there is local liquor, so that is also available, which is you should have an idea of. ठीक है. तो उसको बोलेंगे वो देसी. So, you if you do not understand what is they are saying, then you will be in trouble कि वो समझ नहीं आएगा कि क्या है. So, वो चीज़ें हैं. So, you must have an idea of these things. Then you can calculate from the density of alcohol how much alcohol is going in the body per day. ठीक है. And what is the safer limit, and what this person is, what complications can happen. ठीक है. So, कार्डियोवास्कुलर डिजीज हो सकता है. ठीक है. ये जो NCDs कॉमन NCDs हैं, मेंटल हेल्थ इश्यूज हो सकते हैं. यस, व्हाट मेंटल हेल्थ इश्यूज डू यू थिंक आर मोर कॉमन इन अल्कोहलिक्स? Yes, motor senses. Okay, that is a mental health issue or a neurological issue? It's a neurological issue. ठीक है. Psychological issues क्या है? Mental health. Yes. Any common thing? Yes. Communication is there. But communication is because of the mental state in which if the person has taken a lot of alcohol and having acute alcohol syndrome or something like that, then communication, slurred speech or all those things can happen. But that is not psychological issue. Yes, depression. Any other? Anxiety. ठीक है. So, these are more common issues, and some other issues also. ठीक है. With withdrawal, I told you alcohol withdrawal syndrome. So, that kind of things can happen, right. So, first you have to know what is the burden of the alcohol problem in the community in India and globally. Then what is the who are more predilected, what are the risk factors, and then what are the complications, what can happen, and how to prevent it. ठीक है. Now, the prevention also is there, prevention and control. ठीक है. So, it could be individual level control and prevention, and it could be on the mass level, population level. In public health, we are more interested in mass level this thing, but because you are going to families, then individual level things also will be there. ठीक है. So, coming to the slides. So, we have to know some key facts. So, alcohol or alcoholic beverages contain ethanol, which is a psychoactive and toxic substance that can cause dependence, right. So, it is the ethanol that is causing issue. ठीक है. How many deaths are there worldwide? 2.6 million deaths were caused by alcohol consumption in 2019, and of these 1.6 million deaths from NCDs. ठीक है. Out of 2.9, 2.6, 1.6 million are from the NCDs. That is why I called I started with the NCDs, because NCDs are the main problem right now. ठीक है. What is the number one killer in the world globally? Very good, cardiovascular disease. ठीक है, right now. ठीक है. Earlier it used to be some other communicable disease, neonatal deaths, all those things, but now it has become NCDs. ठीक है, cardiovascular disease. And other 7 lakh deaths from injuries. It can result in injury, alcohol. How? Yes, road traffic accident. Any other? Self harm, suicide or other self harms can also result from this. ठीक है. Violence, harming others. Okay. So, all those things and other 3 lakh from communicable diseases. So, the alcohol attributable mortality was heaviest among the men. So, there is a clear gender gap here, okay, accounting for 2 million deaths compared to 6 lakh deaths among women in 2019. So, 2 million versus 6 lakh, that is a huge gap. Okay. So, it is more common among men, we all know that, but we are also have to be aware of the numbers. An estimated 400 million people or 7% of world's population aged 15 years and older lived with alcohol use disorders. Okay. How much? 7% of world population over 15 years of age. It is not that less than 15 years of age are not drinking alcohol. They are also drinking sometimes. In many cultures, they are drinking from a much younger age also, at homes also. But it is a cut off from where they actually start more, the peer pressure is there, they become more aware of the societal things, and then they started and they have some psychological issues, normal psychological issues also. There is an adolescent period, late adolescence and this thing. So, there are changing social, gender and other influences, and that can also result in increase this thing. So, 7%. Okay. Of this 209 million people, which is 3.7% of world population lived with alcohol dependence. So, it is not that low. So, out of 7%, 3.7% means almost more than half of them, of those who are drinking, more than half of them are dependent on alcohol. Okay. Which means that they can't stay without taking alcohol. So, they are completely dependent. So, that is a big issue. Okay. Because you have to separate those who are alcohol dependent rather than those who are not alcohol dependent. Their problems will be different, the way of health education you will be giving or health information you will be giving, that will be different, treatment modalities will be different, control, prevention, all those things will be much different. It is not that it is a generalized for everybody who is taking alcohol. Just because one person is taking alcohol does not mean that person is dependent on alcohol. Okay. So, that you have to first distinguish. Okay. In general, we terms use some terms like alcoholic, okay, or this thing. So, that those are not very standard terms in medical literature, that is a common language. So, in medical literature we say that either teetotaler, which means that person does not drink at all, never drinks at or have never taken alcohol in life. Teetotaler does not take alcohol currently also and in past also. And if the person is taking socially or this thing, so that person is taking alcohol, but still is not alcohol dependent. And there is a category who is alcohol dependent, who cannot stay without alcohol and will start withdrawal syndromes probably if alcohol is stopped. Okay. So, they are the most high risk people. Alcohol consumption even at low levels can bring health risks, but most alcohol related harms come with heavy episodic or heavy continuous alcohol consumption. So, again there are 3 things here. One very important thing is somebody will tell in the family, ask suppose कि मैडम कितना लेने से ठीक रहता है, ऐसा पूछते हैं. जो अल्कोहलिक है वो भी पूछता है, उसको भी नहीं आइडिया है, वो पूछते हैं कि कितना ले सकते हैं एक दिन में जिससे कोई दिक्कत नहीं होगी. ठीक है. तो व्हाट शुड बी द आंसर? इसका आंसर क्या होगा? पूछेंगे आपको कि एक दिन में कितना तक ले सकते हैं जिससे कोई दिक्कत नहीं होगी. नहीं, आई एम नॉट जोकिंग, दे विल आस्क यू because they are also aware that something happens. They have also seen some people having death or some other health issues with alcohol drinking. Some awareness is there, but they don't know the actual awareness, the actual risk, what will happen, how it will happen, how much it will impact, how many years if I drink that will happen, how many packs if I take daily or bottles I take daily, then it will happen. That they don't know. That is risk communication, as I told you. You have to tell the actual risk to the people and how you are communicating. This is what people are lack awareness, health literacy is poor in these things. Okay. So, what would you say? Anybody from this line only you can say. First line, alcohol consumption even at low levels bring health risks. So, there is no safer limit. You cannot say that this amount of alcohol will not do any harm to you, like that you cannot say. So, even small amount of alcohol can do harm to the body, this has been proven scientifically. Okay. But how much that will create, what exactly at what level, that those things also have been decided and found out, but yes, there is no safer limit to that. You cannot say that this is safer limit, means it will not affect in any way, that you cannot say. Huh. Yes. अल्कोहल के लिए अल्कोहल के कारण रिस्क फैक्टर नहीं होंगे, अल्कोहल के रिस्क फैक्टर हो सकते हैं ना, या क्या बता रहे हो, बताओ. नहीं, आई एम नॉट क्लियर अबाउट द क्वेश्चन. क्वेश्चन फिर से. हाँ हाँ हाँ, यस, वेरी गुड क्वेश्चन. ठीक है. सो अच्छा, ताली क्यों बजा रहे हो, क्वेश्चन अच्छा था इसीलिए. वेरी गुड, बट यू आस्क्ड, आई एम हैप्पी दैट यू हैव आस्क्ड क्वेश्चन. ठीक है, दैट इज द पर्पस ऑफ द क्लास, दैट इंटरेक्शन शुड बी देयर, एंड दिस टाइप ऑफ क्वेश्चन विल आल्सो बी आस्क्ड फ्रॉम द कम्युनिटी. वो भी जानना चाहेंगे कि ये मेरा भाई है, इसको ये नहीं पीता, मैं पीता हूँ, तो इसको कोई क्या है डिफरेंस, दोनों में क्या होगा. ठीक है, ऐसा पूछ सकते हैं. तो दिस इज अ गुड क्वेश्चन. सो देर आर वेरियस फैक्टर्स. ठीक है, क्या फैक्टर्स हैं? जेनेटिक, यस, एवरी बॉडी इज बिल्ट डिफरेंटली, एवरी ह्यूमन बीइंग, यू नो दैट. ठीक है, genetic combinations have some permutation combination of genes is happening, and we are a unique product. Every one of human being is a unique product. So genetic traits हैं which can even within the family different होते ही हैं. भाई भाई से डिफरेंट है, भाई बहन से डिफरेंट है, ऐसे होता है जेनेटिक मेकअप की वजह से. एंड सो विल बी द रिस्क टू अल्कोहल यूज ऑल्सो. सो डेफिनेटली देयर इज अ जेनेटिक कॉम्पोनेंट, genetic risk also, which some people are more susceptible genetically to alcohol use disorder, some people are less susceptible. और इसका भी बहुत सारा रिसर्च हो रहा है और इज गोइंग ऑन. तो जेनेटिक एपिडेमियोलॉजी कहते हैं, जिसमें जीन्स को मैप किया जाता है कि कौन कौन से जीन्स जो हैं वो ज़्यादा ससेप्टेबल हैं, ये हैं. तो दैट डेफिनेटली विल बी देयर, दैट इज़ देयर. ठीक है. हाँ, फैमिली का भी एक होगा कि फैमिली में सेट ऑफ जीन्स हैं जो लेस ससेप्टेबल है एज कम्पेयर टू सम अदर फैमिलीज हु आर मोर प्रोन टू दिस. तो वो भी है. सो दैट इज डेफिनेटली देयर. ठीक है, वी कैनॉट निगेट दैट. बट इन पब्लिक हेल्थ we are more concerned about how can we modify some of the things, है ना. whatever is modifiable, जो जेनेटिक है उसको तो कुछ नहीं कर सकते. ठीक है, जेनेटिक रिस्क डिफरेंट है दो लोगों में, तो भी हम अभी जेनेटिक में आ रहा है स्ट्रैटिफाइड मेडिसिन, जो हमारे यहाँ पर भी शुरू हुआ है, प्रिसीजन मेडिसिन, है ना. वी हैव स्टार्टेड इन एम्स भोपाल, आवर डायरेक्टर हैज स्टार्टेड दिस न्यू ब्रांच एंड some committees there, and we are doing work and looking into projects of that. So stratified medicine means, or precision medicine means, so each person has a customized approach of treatment. ठीक है, rather than only guideline based treatment. to so उसके जेनेटिक मेकअप्स को देख के, उसके जीन लेवल पे जाके सब कुछ एनालाइज करके, और उसके इवन जेनेटिक थिंग्स जो भी वो देते हैं, है ना, वो सब भी हो रहा है. सो दैट इज अनदर टाइप ऑफ दिस थिंग. बट इन पब्लिक हेल्थ वी आर नॉट थिंकिंग ऑफ दैट. दैट इज मोर कॉम्प्लेक्स, स्टिल इन डेवलपमेंट एंड नॉट ईजी टू डू राइट नाउ, कुड बी वेरी कॉस्टली ऑल्सो. ठीक है. सो दैट काइंड ऑफ ट्रीटमेंट वी आर नॉट गोइंग, बट वी हैव टू डील विथ वॉट एवर इज मॉडिफाइबल, what can be changed. If change in behavior can result in decreased alcohol consumption, if some medications are there that can be given, if through counseling that person is understanding, those things we are focusing on. But yes, there is some difference. ठीक है. So but heavy episodic drinking, so if sometimes it's not that that person is drinking daily, but weekly twice suppose he is drinking very heavily, ठीक है. So, that can also be dangerous, and heavy continuous alcohol consumption. These are coming from research, ठीक है, not like that, ठीक है. Effective alcohol control interventions exist and should be utilized more. At the same time, it is important for people to know risks associated with alcohol consumption and take individual actions to protect against the harmful effects, ठीक है. So, that I have told that this is a psychoactive substance, alcohol, ethanol particularly, and alcohol has been used in some cultures. They have been using alcohol in their homes also. You know, there are some cultures where you know, if anybody outside from outside is coming to their homes, they serve alcohol, ठीक है. So, that is also there, ठीक है. We cannot say that what is good or bad or this thing in terms of culture, but yes, health effects we can say that yes, because these are scientifically proven, those things we can say, ठीक है. But we should not this thing their culture, you know, that is going on for centuries, and there could be some genetic changes also because of frequent intake of alcohol, for which research has still to be done. You know, some research is going on, but ethnicity and alcohol use or all those things can be you know, some other challenges, ठीक है. So, worldwide 2.6 million deaths, out of which 2 million deaths among men and 0.6 million among women. So, highest levels of alcohol related deaths are in WHO European and African regions, ठीक है. So, those are the regions where more deaths are happening, and this is the age. People of younger age 20 to 39 years are disproportionately affected by alcohol consumption, with highest proportion of alcohol attributable deaths occurring within this group. So, 13%, see 13% of all the deaths are happening in 20 to 39 years. So, somebody told all ages, yes, that is true, all ages are affected by alcohol, but most common is 20 to 39 years, 13%, ठीक है. So, that is another big issue. Why? For as a public health, obviously it is for the families also, it is an issue. The person you know, at a younger age is dying because of alcohol. It is a economically productive age group, and if people are dying in the economically productive age group, the dependency ratio I had shown you in the demographic class, dependency ratio, do you remember? What is the age group of dependent people? I had showed you a dependency ratio. So, what age group are dependent? Less than 15, very good, and more than 65. In the dependency ratio it is 65, but elderly we say that more than 60 as per definition, but for dependency ratio calculation it is more than 65. So, that will increase if people are dying at the younger age, those who are economically productive, and so that will be creating loss of GDP for the country also, gross domestic product, right, and all those economic losses for the country, right. So, that is important. So, some global data is there from 2009 which shows 19 that 400 million people aged 15 years and older live with alcohol disorders, 400 million, ठीक है, and an estimated 209 million live with alcohol dependence. So, again you know, that is the same, more than half I told, 3.7% of this thing, overall is 7%, 3.7%. So, just more than half are having alcohol dependence. That is a huge number, right. And there has been some progress from 2010 to 19, and the number of alcohol attributable deaths per 1 lakh people decreased by 20.2% globally. So, things are changing, but there has been global shift in gender use of alcohol also slightly increasing for tobacco and alcohol, in particularly in urban metropolitan cities, and that thing also is changing, but overall there is a decrease, ठीक है. So, that has been decreasing. So, that is the good news, and there has been steady increase in the number of countries developing national alcohol policies, ठीक है. So, there are some programs, you know, so alcohol control programs. Do you think that there is any program in India like that? Tobacco के लिए है national program? Yes, there is a program, ठीक है. So, there is a program for tobacco, right. So, national tobacco control program, ठीक है. But there is no such program for alcohol directly, national alcohol control program or something like that, but there are policies, है ना. For example, there are COTPA Act, cigarettes and other tobacco, containing prevention control act, that like that acts are there. Some alcohol related policies are also there, so some substance use related policies are there, but some legal aspects are also there, but there is no national program as of now. But for tobacco there is a national program, okay, that you have to remember. NCDs, there is a national program, NPNCD, national program for NCDs. In that also they say that yes, alcohol should not be taken and what are the treatment and prevention of those, but there is no separate program. But for tobacco there is a separate program itself. Okay. So, there are tobacco counseling clinics, TCCs, all those things are there in the primary care setup or district hospital setup, those things are there. Who will be doing, who are the counselors, full program document is there for that. Okay. So, almost all countries implement alcohol excise taxes. Does India put it, alcohol excise taxes? Alcohol per tax लगता है? Yes, it is there. And different states, it is a state tax. The states also put some tax on the alcohol, and different states have different alcohol. Okay. There are some states which have banned alcohol. There is no sale. Yes. Anybody? Gujarat. Yes. ठीक है, उत्तराखंड, ठीक है. And I think the recent news, I think yesterday's news is that Madhya Pradesh has also banned in some, districts, 16 or 17 districts. They have recent, just yesterday's. So that these kind of news you should be aware of. Okay. Some religious cities and districts and other districts as well, but not all districts. How many districts are there in Madhya Pradesh? That also you have to know. So it's more than 50. Okay. Officially 50 था 2011 में, but some districts have increased. Most probably it is 52 or something now. Okay. So out of that 16 or 17 districts have been banned. Okay. So, however, countries report continued interference from the alcohol industry in policy development. So, alcohol industry. Okay. So, that is, there is always a this thing between the industry, because from the taxes there is revenue generation also, and the government policies of banning and all those things. So, there is a continuous sort of talks around this issue. Based on 2019 data, about 54% of the 145 reporting countries had national guidelines or standards for specialized treatment services for alcohol use disorders. So, what are the national guidelines? Okay. Do India has some guidelines? There are some guidelines. Okay. NSHRC has prepared some guidelines, or some other organizations, NHM has some standard treatment guidelines. Some state guidelines are also there. So, different states have come up with different, but as I told, there is no national program, separate program. Okay. And 46% of countries had legal regulations to protect the confidentiality of people in treatment. So, said there is some legal this thing globally also. Okay. Access to screening, brief intervention and treatment for people with hazardous alcohol use and alcohol disorders remain very low, as well as access to medications for treatment of alcohol use disorders. So, this is an issue. Okay. So, screening, as I told you a questionnaire. What is that? Audit, AUDIT questionnaire. So, that is a screening tool, right, for alcohol use disorders. So, like that screening is not happening. Okay. So, who will you say that it is alcohol dependent or not dependent, or whether alcohol use, how much significant problem is there with alcohol, the screener is not happening. Okay. But some alcohol screening is done by ASHA worker also in India. Can you say from which? Maybe you are not knowing right now, you are first years only, but there is a CBAC form, community based assessment checklist. Who is ASHA? Yes? Yes? ASHA? is the local,
among the local people,
yes, yes,
at a
basic level, mean 8th class. So, it is a local woman living in the village, married woman who is 8th class pass at least have 8th class of education and should be from the same village, married and willing to serve. So, they are selected as ashas and they have a CBAC form, community based assessment checklist, where they have we go and fill in the homes of people. So, that is whether they are using tobacco, alcohol, if they have any chronic NCD, all those things, and they calculate a risk score, that whether this person has to be on priority for NCD screening for diabetes, hypertension, and to be sent to the sub center or health and wellness center, ठीक है, आरोग्य मंदिर, whether that person has to be sent there, ठीक है, that is another thing they are doing. So, some sort of screening is happening in India also, it is not that it is not happening, nothing is happening, it is happening, but it is suboptimal, because after that there is difficulty in handling. Once they are sent to this thing, okay, they will be screened for alcohol and for diabetes and hypertension, but how to deal with the alcohol problem? So, then they will refer to PHC medical officer. Sometimes PHC medical officer is also not well equipped with how to handle the alcohol related problems. Even if he wants to give the treatment, sometimes the drugs are not available in the PHC, or he does not have the training to give the drug, or fears to give the write the drugs, all those things. Then where he should refer? Then he will think of where I should refer. Is there a de-addiction center nearby? In the district hospital, any psychiatrist is there? Is the psychiatrist post there, or post is there, but whether that person is there or not, psychiatrist is there or not, who will he send to, where he will send. So, sometimes these are challenges. Okay. So, overall the proportion of people with alcohol use disorders in contact with treatment services varied from 1% to no more than 14%. So, how many people are accessing the treatment? 1 to 14%, which means the minimum is 1%, maximum is 14% people are taking availing treatment. So, again that is a big issue. So, treatment gap is very high, that is called treatment gap. So, how much is the treatment gap? At least 86%, so more than 85% or at least 86% is the treatment gap. No, people are not taking treatment for that. Okay. So, as I told, there are many diseases, and 31 health conditions have been identified more commonly, although they can create more than 200 diseases can be caused through alcohol, okay? But more common health conditions 31 has been identified, okay? And NCDs I have already told, liver disease, heart disease, all those things, okay? So, depression, anxiety and alcohol use disorders, that is also a separate group of psychological issues. So, they are also there. Okay. So, cardiovascular, you can see an estimated 4,74,000 deaths from CVDs were caused by alcohol consumption in 2019. So, that is a huge number again. Okay. CVD is a very common this thing. Then cancers, it is a carcinogen, and breast cancer, liver cancer, head and neck, esophageal and colorectal cancers are the more common cancers which are resulting from the alcohol use. Okay. So, these things you have to tell the people, making aware. तो अब वो उनको नहीं पता रहेगा ना कि कौन कौन से कैंसर होते हैं, वो ये जानना चाहते हैं कि क्या हो जाएगा, तो उनको बताना पड़ेगा ये, ठीक है. सो 4.4% ऑफ कैंसर डायग्नोस्ड ग्लोबली एंड 4 lakh, around 4 lakh cancer deaths were attributed to alcohol consumption. Attributed means this many were attributed to direct use of alcohol, ठीक है. Other than that, harm and this thing to others, not just them, ये मैंने बताया था, ठीक है. How many accidents you can see, total of 2,98,000 deaths from alcohol related road crashes. Out of that 1,56,000, which means more than half were caused by someone else drinking. So, that is why it is a societal issue rather than only a personal health issue, है ना. वो एक्सीडेंट कर रहे हैं जो जिसने ड्रिंक नहीं किया, वो भी उसका भी डेथ हो रहा है किसी और की वजह से जो ड्रिंकिंग प्रॉब्लम में है. सो दैट इज द इशू, ठीक है, दैट इज अ वेरी बिग इशू. अदर इंजरीज मैंने बताया, फॉल्स हो सकता है, ड्राउनिंग हो सकता है, बर्न्स हो सकता है, सेक्सुअल असॉल्ट, इंटीमेट पार्टनर वायलेंस एंड सुसाइड, ठीक है, हो सकता है, ठीक है. सो दीज आर ऑल इंजरीज. सो इंजरीज इज अनदर बिग इशू ऑफ अल्कोहल यूज, ठीक है. HIV एंड TB के साथ भी एक कॉजल रिलेशनशिप, कॉज एंड इफेक्ट रिलेशनशिप देखा गया है, हालांकि उसको अभी पूरा अंडरस्टैंडिंग उसकी बाकी है, ठीक है. बट सम स्टडीज हैव सस्पेक्टेड दैट these are more susceptible to developing TB and HIV in future, alcoholic people and those who are more into alcohol consumption. और प्रेगनेंसी के टाइम पे अगर लेते हैं तो इट विल इंक्रीज द रिस्क ऑफ हैविंग चाइल्ड एंड फीटल अल्कोहल स्पेक्ट्रम डिसऑर्डर्स. ये सब पढ़ोगे अब आगे इन फ्यूचर. मे बी यू आर नॉट अवेयर ऑफ दीज थिंग्स बट दीज आर सम डिजीज, ठीक है. एंड एसोसिएटेड विद डेवलपमेंट डिफेक्ट्स एंड बर्थ डिफेक्ट्स इन द चाइल्ड, ठीक है. So that is also happening, and alcohol consumption during pregnancy can also increase the risk of preterm birth complications including miscarriage, stillbirth and premature delivery. And this is what I was saying कि gender पहले तो कुछ cultures में होते थे, so females were also drinking because of the cultural things, ठीक है. And now this has there is a shift in metropolitan cities or more urbanized settings where females more educated females are also drinking alcohol. So that is again the shift in dynamics, of the issue, and that pregnancy related issues can also come up. Younger people, as I told already, this I have already discussed, and the social problems including family problems, issues at work. Now sometimes this also happens. Some people in different settings, they drink and they also come to work in that state. So that is an issue. So they will create conflict at work, they will create lack of work or lack of productivity, all those things, financial problems and unemployment, okay. So this I have already discussed. Health status of individual, age, sex, personal characteristics. You were saying the genetic, the last person you were telling about the genetics. So the genetics is personal characteristics, ठीक है. So that is there, ठीक है. So some groups who are more vulnerable at risk, again that thing. So it could be genetic risk, so they could be more vulnerable, or some having some other diseases, so they are more susceptible to these alcohol dependence syndromes, ठीक है. So societal factors which affect the levels and patterns of alcohol consumption and related problems include cultural and social norms, availability of alcohol. So that is why the ban is there, ठीक है. So that is decreasing the availability. Level of economic development कितना है, implementation of alcohol policies हो रहा है कि नहीं हो रहा है, ठीक है. तो कुछ स्टेट्स अच्छा कर रहे हैं बहुत ज़्यादा इम्प्लीमेंट पॉलिसीज़ को, कुछ स्टेट इतना अच्छा नहीं कर पा रहे हैं. सो दैट काइंड ऑफ थिंग इज़ ऑल्सो हैपनिंग, ठीक है. ये क्रॉनिक ये मैंने बता दिया था. लॉट ऑफ थिंग्स, अल्कोहल इंटॉक्सिकेशन के भी बारे में हमने बात कर ली है, ठीक है. इसका जेंडर का है, ठीक है. 52% men were current drinkers while only 35% of women have been drinking alcohol in the last 12 months, ठीक है. और अल्कोहल पर कैपिटा कंजम्पशन वन और एवरेज और 8.2 लीटर्स फॉर मेन कंपेयर टू 2.4 लीटर, वो जेंडर का डिफरेंस दिख रहा है. So last slide will come to the restrictions or the interventions, ठीक है. तो WHO has given some safer interventions. So apart from the individual interventions we already talked of, कि उनको रेफ़र किया जाएगा, उनकी काउंसलिंग होगी, उनको ड्रग्स दिया जाएगा, उनको रिहेबिलिटेशन सेंटर में भेजा जा सकता है, डी एडिक्शन ट्रीटमेंट सेंटर्स जो हैं वहाँ भेजा जाएगा, वहाँ उनकी काउंसलिंग होगी. अपार्ट फ्रॉम दैट देयर आर अल्कोहल एनोनिमस ग्रुप, ये नाम सुना है. So alcohol anonymous are some social groups which are people who are dependent on alcohol, who are heavy drinkers, who have been dependent and they have they have their financial, social and other issues. Now they come up as a group and उसको एक मतलब एक कुछ लोग उसको मिल के स्टीयर करते हैं उस ग्रुप को, and they come and discuss their problems and share their issues and they want to de-addict themselves. तो वो कैसे बात करके और आपस में मिल के, वही जो अल्कोहलिक्स हैं, जो अल्कोहल डिपेंडेंट हैं, वो लोग मिल के इस चीज़ को करते हैं, उनकी मीटिंग्स होती हैं, ये होती हैं. सो दीज आर ऑफिशियल ग्रुप्स इन मेनी सिटीज़, भोपाल में भी है, ठीक है. सो any person who is dependent on alcohol can join that and this thing. So क्या क्या कर सकते हैं, स्ट्रेंथन रेस्ट्रिक्शंस ऑन अल्कोहल अवेलेबिलिटी, ये मैंने बताया था, बैन और दिस थिंग का, ठीक है। कहाँ पर अल्कोहल सर्व हो सकता है, कहाँ नहीं हो सकता, रेस्टोरेंट्स वगैरह में, कहाँ पर गिविंग द लाइसेंस एंड ऑल दिस थिंग्स। हाँ, जस्ट 1 मिनट, ठीक है। एडवांस एंड एनफोर्स ड्रिंक बिफोर ड्राइविंग काउंटर मेजर्स, ठीक है। तो रोड यूजर्स के बारे में बताया था, वहाँ पर वो करना है, लॉट ऑफ पॉलिसीज हैज़ टू बी देयर। फैसिलिटेड एक्सेस टू स्क्रीनिंग, ब्रीफ इंटरवेंशन से ट्रीटमेंट, ये भी बताया था कि ये प्रॉब्लम है, स्क्रीनिंग नहीं हो रही, ये नहीं हो रही, तो इसको बढ़ाना है। एनफोर्स बैन ऑन रेस्ट्रिक्शंस और अल्कोहल एडवर्टाइजिंग, स्पॉन्सरशिप एंड प्रमोशन, सो ये इसको बैन करना है। कई जगह ऑलरेडी बैंड है, बट इसका और भी वो होना चाहिए। रेज प्राइसेस ऑन अल्कोहल थ्रू एक्साइज टैक्सेस एंड प्राइसिंग पॉलिसी, जितना आप प्राइस बढ़ाएंगे उतना लोग कम इसको खरीदेंगे, सो दैट इज अगेन अ पॉलिसी फ्रॉम द गवर्नमेंट साइड, ठीक है। इज दैट फाइन? यस। कैन यू गिव अ पेपर, जस्ट अ piece of paper, yeah, take that and यस। एक बार उनको बुला लेना, वो बाहर जो खड़े हैं उनको बुला लेना। यस, आई विल टेक। ओके, रोल नंबर 1 2 3 4 4 कौन है? नहीं है। 5 6 7 8 9 10 11 12 13 14 15 16, बंद करना है तो कर दो, अटेंडेंस ले। 16 17, हु इज 17?